I want to start out by again thanking the Houston Health Department and the Astros Foundation for the incredible work they did to conduct the COVID-19 vaccine super mega site this past Saturday. In fact, we exceeded our initial goal when we set up to 3,600, but in actuality, they gave vaccination shots to 3,852 people. So I certainly want to thank Director Williams and his entire staff for their efficient operation at Minute Maid Park, and heard from a number of people who found the process to be quite highly efficient, and that the people out there were very nice and accommodating. I also want to thank Houston Fire EMS personnel, Chief Pena. Thank all of your personnel for the work that they did out there at Minute Maid. The Houston Police and the Rodeo Houston volunteers, who also worked together to get people through the process, from parking, getting inside the ball stadium, making sure paperwork was completed, to getting the vaccine. And last Friday, the state sent the city of Houston 8,000 doses of the Moderna vaccine. If you can recall, when we met on Thursday, we said that we did not know whether we did not know whether or not we were going to get a shipment for Saturday, but on Friday morning that shipment came in, 8,000 doses, and on Saturday we used some of that allotment to increase the number of people who could get vaccinated at Minute Maid Park, and we were able to go up to 3,852. In fact, once we opened the registration line, 1,000 people, for example, signed up in less than a half hour. So in a few minutes, Houston Health Director Stephen Williams will discuss more of our plans for a future COVID-19 vaccination program, as I will hope to continue what we did last Saturday, and then depending on the availability of the vaccines, to even open up a north site. That's my hope, that we could do both a north and a south site, but that will depend on the availability of the vaccine. So for example, if that 8,000 shipment that we received on Friday was the advance for this week, then it's kind of going to put us behind the ball. So, and that's what we're seeking clarification, whether or not the 8,000 we got on Friday was the advance of shipment for this week. If that's the case, then we use some of that shipment for last Saturday, because we don't want these vaccines sitting on the shelf. So it's my hope that there's another shipment that's coming, and if that's the case, then there can be a north and a south site. We'll plan accordingly, and then we will see what happens. The reality is that there's a huge demand, and we just need everyone to work with a greater sense of urgency. So we certainly want to work with our federal and our state partners. I know we all want to get it out. Today, and let me tell you why. Today, the Houston Health Department is reporting 1,460 cases of COVID-19, bringing the total case count for the city of Houston to 131,035. So in the past week, we've seen how the numbers have been above 1,000. I suspect, and Dr. Peirce can speak more to this, that we're pretty much we're in the middle of the storm, and right now. And I suspect that the next 2 weeks for the city of Houston will be very, very important, because now we're getting the cases coming in from the holidays and the aftermath of the holidays. So again, I'm asking people to be very mindful of their behavior. That it's very important now to get tested. Okay, it's important now to get tested to know whether or not you have the virus and carrying the virus, especially if you are asymptomatic, because you don't want to spread it to other family members and friends and employees. So please get tested. Please get tested. And then keep these masks on and wash your hands and engage in the social distancing, because, you know, we're right in the middle of the storm right now. And I suspect we'll be in the middle of this storm for the next 2 weeks, or the next 2 weeks will be very telling, because what we're needing now is to flatten out and then start bringing these numbers down. In terms of the hospitalization, there are more than 2,100 people in our hospitals. And as you know, at the peak of the storm during the summer, it was a little bit more than 2,400. So now we're a little bit more than 2,100. We're moving closer to that where we were during the summer. So again, please check your behavior and help us to flatten this curve. The total number of COVID-19 related deaths in Houston increased by 3 to 1,600. So that's, what I'm finding interesting is that the death number is still modest. And again, I'll defer to Dr. Purse on that, but the number is increasing by 3. That brings us to 1,600. The rolling average positivity rate is 17.4%. Which is up from last year. So that's a significant number. 17.4 is the positivity rate. So that number is moving in the wrong direction. The number of hospital admissions moving in the wrong direction, and we need to be very mindful of our behavior. Today I received word that another City of Houston employee has died from COVID-19 complications. Jose Rubio was a 27-year employee of Public Works. He had been battling the virus since mid-December, and I want to send my condolences to his loved ones and to other families across Houston whose lives have been changed as a result of the virus. So let me ask you to remember the family of Jose Rubio. Keep them in your prayers. Jose Rubio, a 27-year employee of Public Works with the City of Houston, and we appreciate his service and we'll be praying for his family. Sadly, too many lives have been lost and too many people have fallen ill. We know a lot of this is preventable if people would continue to wear their masks, avoid large crowds, and practice social distancing, wash their hands frequently, and get tested. And then let me say something else. When people are going out to lunch or dinner or breakfast, restaurants, let me remind people that it's important for you to put on your mask. Keep those masks on except when you're eating, or drinking. But once you have, before you eat, before the meal comes, keep the mask on. When the meal does come, of course, you got to take your mask off to eat. But after you finish your entree, while you're still sitting around and talking, put those masks back on, okay? So it's just important that we adhere to all of the health protocols that we talked about in 2020. And then just a quick update on the direct assistance that the City of Houston gave. We were giving out checks to 1,200, checks in the amount of 1,200 to people who qualified in direct assistance. All of those dollars have now been issued. Those checks have been issued. A total of 16,922 checks in the amount of $1,200 went out to different individuals. That's 16,922 checks went out for a total amount of $20,366,400. So we'll do that. And then lastly, I think we just want to make, some people have asked, when it comes to that second dose, that second vaccine, do they have to contact HPD, the Houston Health Department? And the answer is no. The Houston Health Department will be contacting them. Is that yes? So you don't have to contact the Houston Health Department for that second dose. The Houston Health Department will automatically be contacting you and giving you those instructions.